I want to just say, just imagine for a minute, if they had begun by pushing for single-payer health care, if they had really come out fighting, if they had tossed out the filibuster rule, if they'd passed immediately the Employee Free Choice Act, started to build a real labor movement with the goal of making single-payer health care happen, with the actions to back up the sort of talk of quoting Franklin Roosevelt, and then the whole debate would have been different, right? And this could still happen. This doesn't have to be imaginary in the past. This could be round 2 when this bill goes down, if it does. But you start the debate with single payer, and you let the Congress members compromise, right? It is not the role of citizens or activist groups to compromise. That's not strategic, that's not informed, that's not wise, it's not smart. It's taking on somebody else's role. It's the job of the Congress members to do the compromise. We should be demanding exactly what we want, and if it gets to a point where there's a bill to support and it's not exactly what we want, but it's a step forward and it's a compromise, then we should support it, but we should do it without self-censoring, right? We shouldn't be having these rallies where you're forbidden to say the word single payer in order to focus better on public option. You should be able to describe the ideal of single payer and explain why public option is a good step worth fighting for. Right? Because if the debate were about single payer, if it were in fact about just enlarging Medicare to cover younger and younger people, including all of us, then you couldn't make up imaginary death panels. Medicare is Medicare. It is what it is. You're expanding it. It's as simple as that, right? You're doing what other nations, as Bob said, around the world have done more efficiently, more effectively than we are doing. With better results. And you're not just making it simpler and shorter and blocking the easy lies and distortions, but you're making it a human right, a civil rights campaign, not this wonkish public option stuff. I mean, during this campaign for the public option, we've had people going to jail on Capitol Hill and around the country for single payer. Can you imagine if it was a campaign for single payer? If all of the activist groups that take their marching orders from the Democratic leadership and go out and tell people what to rally those Democrats for, thereby turning the people into props, demanding what has been pre-approved to be demanded, if they instead were asking their membership what to rally for, and were pushing that campaign, we would have a whole different discussion. And people like Max Baucus, who some months back was supporting the public option, would be begging and pleading to have the public option instead of single payer, rather than the debate we have now, which is how can we put off the public option until there's some sort of healthcare crisis or something, you know, which is what we're looking at. You would have a discussion about economic stimulus, better than the one we had, better than the bill we did, right? 2.6 million new jobs from doing single-payer healthcare. You would have a very, very different discussion about money, about the economy, than the one we've got. And you would be talking about a human right, and it would be a completely different scene. People get off their chairs and act for a human right. They don't do it. They don't do it for a little bit better healthcare bill. That being said, the fact that the Progressive Caucus members have for the first time in world history taken a firm stand for something, if they don't cave in, which is what everybody else in Washington clearly expects them to do, is remarkable. Doesn't matter how good or weak you think the public option is going to be, the fact that they've taken a stand for it, if they don't back down or distort it, is going to be incredibly advantageous, and if they do cave in, it's going to be disastrous on every issue. I think in the long term, I just want to give sort of what we might do in the long term and what we might do in the short term, and then have a discussion about it and about the merits of the New York Times. In the long term, we need public financing of campaigns. We have over the past several years, the figure I read today, $375 million in advertising and lobbying by the unhealth industry, which which could probably, under an efficient system, provide health care coverage for a year for everybody who lacks it in this country, for 40, 50,000 people. And that's just been spent on the lobbying and the advertising. We need, and the campaign contributions are incredible. We need free media for campaigns. It's the only way. We own the airwaves. We give all progressive organizations, labor unions, give all this money every election cycle to the campaigns. They feed it into the corporate media for ads. It's the single biggest expense. And those media outlets destroy us for the rest of the year. Why not partially sit out one election cycle and create a new television network that actually covers the news and benefits working people? Why not think about media that works, even under the current system, without reforms? But we need fundamental reforms. We need to bust the monopolies. We need to open up independent and public media. We need the individual right to vote. We need everybody to be registered when they turn 18 automatically, so that we don't have this voter registration that then we think of as activism, whereas it's actually busy work. We need verifiable voting. We need it on paper. We need it counted publicly, locally, with every observer and added so that we know who we're voting for. And we need to drastically reduce, not increase, the power of parties, much of which comes through the distribution of money. So if you clean up the money, you're working toward that end. But seniority, positions on committees, chairmanships, your bill getting a vote, earmarks for your district, it is very, very difficult for Congress members to disobey their parties. It's very easy for them to disobey their constituents. We need to fix that. We need to join international treaties that treat healthcare as a human right. There are so many rights that we have already, in theory, on paper, that we don't actually have, but there are so many more that we are one of the few holdouts on so many international treaties. So we need to create rights that include healthcare, that include housing, that include education, that include workers' rights of the sort that Employee Free Choice Act would move us in the right direction on. And I would argue we need a basic welfare. We need a basic income guarantee. We need a maximum wage. We need something to guarantee a decent standard of living for everyone in the wealthiest country on the planet. And we can talk about those different strategies to get it if you want. We need the right to conscientiously object, strictly enforced. We need the right to know our rights, for our laws to be public and comprehensible, and public before they're voted on. We need our laws to be equally applied to everyone, because we are rapidly developing a class system of those who must obey laws and those who must not. And the pretense of that we aren't is almost gone now from the corporate media. In the short term, I think we need to pressure Congress especially. We need to pressure the corporate media. We need to make our own media. We need to take advantage of the good media outlets that really are competing with the corporate media now. We need to demand an end to all this catering to right-wing lies. The White House firing someone because a right-wing nut screaming head asks for it, right? As if he's going to now be nice and like you and not ask for any more. No, he's got a list out there of who to investigate to ask for their heads, right? I mean, you think of one of our best senators, Senator Feingold, when he approves Ashcroft's nomination and says, well, then the Republicans will be nice to me. And he learned better, right? But he's way out ahead on the learning curve. These guys are slow, right? And you give the Republicans 90% of what they want on health care, and they call you a socialist and a foreigner and an evildoer and a murderer of grandma. If you had come out for single payer, they would have called you the exact same things, where they would have brought the exact same guns to your rallies. If you had come out and thrown out the filibuster and said, we're going to ignore the Republicans, they've been voted out of power, they got something useful to say, we'll wait to hear it, and rolled through with a progressive agenda, they would have called you the exact same things. There's no way you could energize the right-wing base more, and yet that fear of energizing the right-wing base is at least used as an excuse for not doing these things.